Today we're going to talk about sex and the presence of strong sexual feelings in the room. Someone wanted me to speak on that, and I have to say I have a lot of really good looking men in my practice, and I think I'm probably a little bit in love with all of them. But one in particular I have very strong sexual feelings for, and he is a man who never got married, and he's come to me later in his life because he wants to settle down. But he's gone from woman to woman, and he's probably one of the sexiest men that I have ever met, and he's a womanizer. He's a real Don Juan. And he has not been able to stay in treatment with anybody because it just doesn't interest him. So I find that because he goes from woman to woman and he needs that beautiful sexual feeling and for things not to get too intense, that I can flirt with him shamelessly and have a lot of fun with him. And in fact, I even have a nickname for him, which is Chippy, because he described to me once being at a beach and he was dancing, and so I started to nickname him Chippy, and he is just so hot. And I tell him, you're just so hot. We have a lot of fun, but he met a woman recently who's very beautiful and he wants to be with her, and some of the more difficult feelings are setting in. And if we didn't have that foundation of flirtatiousness and fun and kind of being on the same page together, I don't think we'd be able to go there with what he needs to feel and accept in himself to have a bigger commitment. So if your patient needs you to feel aroused and needs you to feel sexual, you have to go there, and I personally enjoy it a lot. Now, sometimes a patient will arouse feelings in you that is not about them and that are not helpful. I had a patient another very seductive man, who I feel was routinely raped by women. Had maybe 3 or 4 different wives, and they liked to use him sexually, and he always had to take care of his mother. And I found that my overwhelming sexual feelings with him had to be under study, careful study, and my desire not to treat him and to leave my husband and go and run away with him was really had to be analyzed, and the strength of it was a testament to the deep pathology and abuse that he had suffered, that he didn't want to know about because he was having fun seducing women too. So how you deal with the feelings is very different from patient to patient, and sometimes you'll fall in love with the patient because they provide you with something that you don't have maybe in the relationship with the person you're with, and then you have to know that that's your countertransference, and you have to go through whatever grief and supervision to make sure that the feelings don't interfere with being where the patient needs you to be. So I hope that you will enjoy all the immensely powerful sexual feelings that come up in therapy or in your life, and that you'll understand them and embrace them well enough that they won't get you in any trouble at all. Bye.